So welcome to once again another session with Dr. Fresh, and today we're doing a very interesting concept called menopause. So we all know what menopause is. It marks the new phase of a woman's life following the end of her normal regular menstrual flow, ovulation, and normal cycle that keeps her going as a woman. So there are three types of menopause. We have the natural menopause that a woman naturally goes into. Now, the average age of menopause is 47 years. So most women go into menopause at between 47 and 52 years of age. However, that timing is more what we call the natural menopause, 47 to 52 years of age. Now, there are women who go into menopause before 40 years. They stop seeing their period, they stop ovulating, there's lots of other things and changes. They start having hot flushes, dryness of vagina, and lots of other things. They start experiencing that when below 40, 37, 35. Such condition, we call that early menopause. Early menopause. Some people don't even consider it as more as a premature menopause because it's a menopause that comes before expectation. So some people also refer to this as what? As premature menopause. And there's a subclass we'll talk about here, we call ovarian failure. When women go into menopause before 40 years, it's most likely considered due to ovarian failure or ovarian insufficiency. The ovary have failed in carrying out its function, producing hormones that help to regulate the woman's cyclical life, her hormones, her cycle, everything to keep her as a woman, to keep her going in that field. Number 3, we have induced menopause. These are menopause that occur, the woman stops seeing her period because she's exposed to certain drugs. For example, she has a cancer and she's on drugs, cancer drugs, chemotherapy. There are some cancer drugs that can stop a woman, that can throw a woman into menopause. And that's the surgery. Some women have been victim of this. They went for surgery, and unknown to the doctor removed both of her ovaries, the right and the left ovary. I know what happened. The woman goes straight into what we call surgical menopause. Number 3, some people have some kind of illnesses that they require radiation therapy. As they are exposed to radiation, the radiation hits the ovary. As it hits the ovary, they become dormant and inactive. They are unable to carry out their function. So such women, their period ceases to exist. They did not ovulate, and a host of changes that are responsible for menopause come into play. In a part 2, I'll tell you about how to identify the woman that going to menopause, and then part 3, we'll talk about how do you help cope with menopausal changes. Subscribe and keep watching. Remember, if you know better, you will do better. Cheers.